ambulance service? Is the patient breathing?
My name's Kim, I'm on the ambulance crew, all right?
This is the Scottish Ambulance Service.
We genuinely get to make a difference in people's lives.
The job literally is life and death.
No needles or anything on them, though. There's nothing I would rather do than this.
Serving every one of us.
It's okay, love. It's all right, don't worry.
From Scotland's busiest cities to its wide open countryside. Wherever we have fallen, whatever has happened to us.
Need a hug?
I'm scared she's going to die.
But this is a service under extreme pressure.
We're constantly apologising to people.
Yeah, it's very busy down here.
Which we rely on like never before.
We're 2 shifts down in Edinburgh and 3 in the borders.
Here we go, here we go, here we go.
On the front line and at the other end of the line.
1, 2, 3, 4.
Scotland's paramedics keep Scotland safe.
Breathe the gas.
And alive.
Help is coming, they're coming as fast as they can.
This time, a patient needs a lie down.
You feeling sick or anything? Oh, lying back, he's going a bit bratty. Just going to lie you back if you touch, buddy.
Crews rush to the scene of an incident on railway tracks.
The person's been found.
It's been confirmed this year.
Okay.
We haven't asked life status, and that's unknown.
And no amount of persuasion will bring some patients into hospital.
So if we told you the full Celtic team were up at the Royal, we're still not going to win this game, no?
No.
No.
Not even the Pope is up there.
It's the height of summer in Edinburgh. And long-time crewmates Martin and Kevin are feeling the heat.
It's a bit toasty now. I'll be burning like a wee charcoal briquette if this keeps up. Go ahead, control. Yep, that's all received. We shall head along to that now. Thank you for the update.
Roger, thank you. Controlling.
It's not going Jarvis, Mark. There you go. Anyway, so we're going to a 57-year-old gentleman who has fallen off his electric mobility scooter. Oh, maybe not a mobility scooter. It just says electric scooter, so it's maybe one of these.
Yeah, it could be a
ordinary electric scooters, and he's got a head injury apparently, and it says he's also having difficulty in breathing at the moment as well. These electric scooters can go quite fast. Some of them can go kind of 30, 40 miles an hour. A lot of people don't tend to wear cycle helmets with them, so you're considering, has he hit his head when he's fallen, has he been knocked unconscious? So you're kind of taking all that into account as you're approaching.
looks like a scooter.
Yes, I don't think it's been a mobility scooter. No, it's one of these wee electric. Gonna have a wee chat, see what's happening. Hello there, I'm Martin, how you doing?
Something I know, I just controlling.
You just come off. Did you have a helmet on?
Nah.
Oh dear.
When you buy one the other day, we went with my side.
Oh, nightmare, eh? Where are you sore about, buddy?
Just scraped, breathe like a
right.
stun with it.
Although the patient, Mark, is sure he's fine, Martin is concerned his injuries could be more serious than he realises.
So the call came through that you had a head injury and you weren't breathing right. Right. Where about did you bump your head? Over there. Okay. Any pain down here?
No.
Any pain down your back?
I've always worked over my back, so I've got a broken neck anyway.
Okay. Nothing new though, eh?
No.
And were you knocked out at all?
No.
No.
I was just stunned.
He had quite a lot of scrapes and cuts, but he was alert, he was talking to us, which was good. He was able to tell us what happened.
But then again, it might be something a wee bit more serious. He might have a wee fracture somewhere in one of his joints or one of his limbs that isn't obvious to the naked eye.
1, 2, 3.
After checking his neck and spine, the crew helped Mark to the ambulance to further examine him in privacy.
Too old for a scooter?
I only bought it 2 days ago.
Oh, did you? Oh. So I want to have a look at your shoulder as well, because you've burst the fabric on your shoulder, so... Ah, you've grazed and skint your shoulder up here. Okay, right. Let's just have a wee... Nothing bony or that, just all scrapes. Chest okay, all feeling intact. And this wee...
What was the last thing to hit the gun in my head?
Yeah.
I was just stopping.
I think you've done well, you've saved the vital bit, eh?
Thought my face was going to hit the ground.
There's no damage or good looks anyway.
While it appears Mark's injuries are superficial, the crew still want him to go to hospital to ensure there are no internal injuries.
So everything does look like it's grazes and scrapes and stuff. Our advice would be to pop up to the hospital with us just for a wee check-up. No.
Spent 4 weeks in there and then 4 weeks in the Western City.
Oh, you'd be sick of it, eh? I mean, you're the man that knows how you feel best, so...
If I feel worse, believe me, I'll go up there.
Aye.
This gentleman didn't want to go to hospital, and we spent a bit of time trying to persuade him to go to hospital.
I think he was being quite stoic about it all, and there was probably a wee element of embarrassment that he's come off his scooter and just wasn't wanting any fuss made. You need to keep an eye on these scrapes. If they look like they're getting infected, get yourself along to the doctor's surgery, okay? I'll no fiddle about with any Murphy. We'll get a wee bandage on this one first. This is the worst one. Wee bandage, it's got a wee bit of cold water in it again. You feeling sick or anything?
Just dizzy.
Take it you weren't feeling dizzy beforehand?
I was stunned earlier on, I was dizzy, I couldn't move.
But before this happened?
Well, I was fine.
That would be another reason we'd be keen for you to go up to hospital if you're feeling dizzy now. You know, I think it'd be a good idea. Get another BP up. Oh, lying back, he's going a bit bratty. Just going to lie you back a wee touch, buddy.
Mark is experiencing an episode of bradycardia, a condition where the heart beats slower than normal, and as a result, the blood pressure drops.
All right.
Just lie back.
Just lie back now. Can lift the arm up.
Oh no, lie back, Mark. When someone has an accident or a kind of big fright or a big scare or something, you get the fight or flight instinct. So you get a big rush of adrenaline and everything into your system to prime your body for that. And what happens after 20-30 minutes or so, when everything's calmed down, some people can have a drop in blood pressure because the blood pressure has been maintained by this kind of artificial level of adrenaline for a wee while. You just about fainted there. Aye.
Yeah.
Just nice and relaxed. Your heart rate went a wee bit low there for a second.
Call handlers in Scotland's ambulance control centres are at the forefront of the country's emergency response network.
Ambulance emergency, is the patient breathing?
At the centre in South Queensferry, many of the staff are veterans of the ambulance service. But some, like Lauren, are newer to the job.
I love my job. I've been here for 14 months and I can't see myself doing anything else. It's lovely to know that at the end of the day you've made something better for somebody somewhere. Plus, what other job do you get to deliver babies in where you don't have to do any of the physical work? Literally the best call that we could ever hope for is a baby call.
But Lauren's next call isn't to help deliver a baby.
We're going to get the best help arranged for you. So I want you to focus just now on taking steady breaths for me, all right?
It's a call from a male in his 30s.
When he came on the phone, he was very panicked and was explaining that he had a really severe chest pain. It was going down into his arm and he'd actually lost the use of one of his arms because of that pain.
I want you to sit down for me. Make yourself comfortable. Are you clammy or having cold sweats? You are.
Our cardiac age is roughly about 35 for men, which when I heard it during training, it took me by surprise because it's young. You know, you never think about a 35-year-old just having a heart attack. But at the same time, we have to be prepared for anything.
Have you ever had either a heart attack or angina? No. Did you take any drugs or medications in the past 12 hours? I'm organising help for you now. Stay on the line. I'll tell you exactly what to do next. Do you or anyone there have any aspirin or medication containing aspirin available?
Aspirin is a known blood thinner, but it also gets into your system nice and quickly. So what we instruct for a chest pain call is 300 milligrams worth of aspirin, and we get them to chew it.
Aspirin helps thin the blood and improve blood flow to the heart, but this caller has none to hand.
Right, so that's fine. So take a seat somewhere and find somewhere comfortable at the moment, all right? If you focus on taking steady breaths, they don't have to be deep breaths, but they have to be steady breaths.
If you ask them to take a steady breath, then it doesn't have to be, which if they're having chest pain can make it so much worse. But a steady breath is just concentrating on keeping it nice and routine, nice and slow, nice and even.
I want you to focus on taking steady breaths, all right? And we will be there with you as quickly as we possibly can.
I don't ever want to leave somebody feeling as stressed as what they did when they came on the phone. We're getting help and that's what we're here for. So please don't feel as stressed because you know that help's coming.
Anything worsens in any way, you give us a wee phone back, okay? But concentrate on those steady breaths for me and we'll be there soon, okay? All right, take care.
In Edinburgh, Kevin and Martin are treating a patient who's fallen while riding an electric scooter.
How are you feeling now? Still dizzy? No, nice and still. Have you ever had any problems with your heart rate before, Mark? No. So your blood pressure's dropped a wee bit and your heart rate's gone a wee bit low. So just you lie nice and still. I'm going to move your t-shirt up and we'll just pop some wee sticky dots on your chest, okay?
The crew carry out an ECG, or electrocardiogram, to see if Mark has any problems with his heart.
Just lie still, Mark. You're okay, buddy. Just with the shock of what's happened to you. Can you tell me what day it is? What month is it, Mark? Mark? Can you talk to me? It's important, I need to know if you can talk to me. Mark, I'm going to pop a wee needle in your arm in case we need to give you any medicine, okay? We're going to have to take you up to the hospital though, okay? Listen, Mark, we can't leave you now after what just happened there. Mark, we need to take you to hospital. I know you didn't like them, but you just had a big drop in your blood pressure and your heart rate went down. Just stay on your own.
Right. That's another reason why you should go to hospital, Mark.
You want to sit up a bit more? Okay. Nice and gentle. There you go, try that. No, just relax. Leave it at that just now. I want to keep an eye on your blood pressure as we're setting you up. Right, listen, Mark, I know you didn't want to go to the hospital, but you've had a bit of a dunt off your scooter, okay? I'm sure you will, but we'll have to advise you go up to hospital. See if
but you were younger then, Mark.
you were more bounceable.
While paramedics can strongly advise a patient to go to hospital, they cannot force them against their will.
Right, Mark, we need to have a chat. And I need you to listen to me, because I need to make sure you understand this. My advice and my strong recommendation is that for your benefit and your safety, we should take you up to hospital. They keep an eye on you for 2 or 3 hours, and then I'm sure you would get back home after that, okay? So, if you don't want to go to hospital, what I need to do is I need to get you just to sign a thing for me saying that... Aye, basically, okay? Now, even by signing that, if we go away, you can still dial 999 and get another ambulance. It doesn't stop you getting another ambulance. So, will you come up to the hospital with us? What about if I say pretty please?
With Mark still refusing to take their advice, they must let him go.
Yeah, you can hold on to that. Right.
Just stand for a minute.
You want to sit down again? You didn't look at. Come on, let's take you to hospital. You're not going to manage the stairs like this. You can't even stand up.
Aye.
Yeah? Right, good choice.
I think so.
Come on then, get your bum back up here.
The guys agreed now to go to hospital. I think he's taken the wise choice to go, and once he stood up he was feeling dizzy again. And most probably would have fainted or collapsed again. So, yeah, good decision to go.
Sure you can't give you something for the pain?
No, I'm alright, honestly.
It's the ambulance service, there's no medals for heroes here. You alright?
Finally, the crew make their way across Edinburgh to the Royal Infirmary, where Mark will have his injuries assessed to rule out anything more serious.
2 days when you screw up. Fun with it last day there.
Fun for the 2 days.
Inverness, the capital of the Highlands. A beat that encompasses everything from dramatic landscapes to the hustle and bustle of city life, and where the tranquility of country roads is sometimes preferable to negotiating city traffic.
No, you're not going to stop, you're going to keep coming, okay. Thank you.
Paramedics Jamie and Heather are on their way to the south of the city, where a 96-year-old man is suffering chest pain.
Chest pain's quite a big umbrella, as it can be cardiac, it can be respiratory. So we need to kind of determine, as to what type of chest pain are you experiencing. So we have to ask quite a lot of questions to explore that, to give us a better picture as to why this chest pain has occurred.
Hello. What's your name, sir?
Gerald.
Gerald, I'm Heather and this is Jamie.
We arrived at the house to find the patient lying in a recliner chair, and he had said that he had experienced some chest pain earlier.
It wasn't the doubling up type of pain, but it was very different pain.
Okay, have you had that kind of pain before?
I have, yes. Well, I had a heart attack back in January, I mean a genuine one.
Yeah.
Gerald spent 6 days in hospital following a heart attack earlier in the year. So the crew need to make sure he isn't on course for another.
But what were you doing when the pain came on?
I was just sitting watching television.
And it just came on?
The left side
Can you describe the pain for me? What did it feel like?
Nagging.
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 And did it go anywhere? Did it go through to your back or down any arm? No, nothing.
It stayed where it was.
And have you had that pain before?
I think so. Anyway, I used the spray. And
that helped?
Yeah, it did. It receded.
Gerald has taken a dose of his GTN spray, a medication used to treat chest pain.
So have you got no pain at the moment?
Well...
Is it still there? Is it like a niggle? Is it still there?
Tiniest niggle.
Despite Gerald not being in significant pain, the crew still carry out a full set of observations.
Gerald, I'm going to do an ECG on you.
OK. Sorry to be a nuisance.
You're not a nuisance at all.
There we are.
Do you live here by yourself, Gerald?
Unfortunately, yes. My wife died 2 years ago.
Oh, sorry to hear that.
So, Gerald, I'm noticing here you were a doctor?
Yeah, of science.
Were you a doctor of science?
Of science.
What did you do for a living, Gerald?
I was an animal geneticist, animal breeder.
Did you work up here, or...?
What is now the Roslin Institute.
So we're seeing some differences. It's not a normal ECG, but that could be your normal from after having the heart attack.
Totally dropped.
What would it be like if it was normal?
So the changes we see in your electrical activity is we see a first-degree heart block. So it's like your top of your heart is beating and there's a wee bit of a delay before the bottom heart.
If there's a perceived abnormality on an ECG, we will send it into the coronary care unit for a comparison of a previous ECG, as that abnormality may be normal for this patient.
Hi, staff nurse. My name's Heather. I'm a paramedic with the ambulance. I've sent you through an ECG. Yeah, well, he's had an episode of chest pain, but we saw the right bundle branch and we thought, well, get a comparison as to any of his previous ECGs. Gerald, I've heard back from the hospital, so there's no changes at all that we can see. So your ECG that we've just done just now is completely the same. I got the thumbs up, so all good. And you're pain-free at the moment.
Yes.
So if you have another episode of chest pain, you can always phone us back on 999. All right?
Yes.
It's not one-stop shop.
On the coffee table is a book that has drawn Jamie's attention. Gerald's biography, following his career as a distinguished research scientist.
A very interesting life you've led.
I had a very charmed life, yes.
Was it a biography?
Aye. The synopsis there's brilliant.
So his wife was an author and actually had written about Gerald because he's had such an interesting life.
This book that your good lady wrote, it's your biography.
Yes.
Covering your life and your escape from Germany.
Yes.
Under Nazi rule. Brilliant.
I came over on a kinder transport in March 1939, age 12.
Wow. Did you have your parents with you?
No.
No. I'm just looking at all your old photos in the book.
All right, yes. If you were to Google me, I would come up under Yak, because I spent many years going back to China to help with the yak breeding.
I'm seeing a picture of you on your book.
On a yak.
On a yak. Very interesting man. He was really giving us a lot of information about his past life. It was really good.
We were skiving now.
Bye then.
Right, we shall see you.
Nice to meet you, Gerald.
You've been wonderful.
See you soon, guys.
What a lovely gentleman. That's why we do our job, is meeting people like that.
In South Queensferry.
Hello, sorry to bother you, it's the Scottish Ambulance Service. I'm Martin, one of the paramedics.
Senior Clinical Support Manager Martin is triaging a patient to determine whether their call needs escalated.
Now that you're with her, is she conscious and breathing?
Martin's worked in the ambulance service for 23 years.
I started off as a care assistant working with patient transport services. I've built up my career from there, from a technician to a paramedic. I did some time with special operations and latterly came into the control room about 6 years ago.
He's speaking to a family member of a patient who is suffering a severe headache.
Right, and is it the front of her head that she's holding? Is she just kind of sort of cradling her head? Right. Left eye, okie doke. And doesn't suffer with anything like migraines or... So never had this before, okay. So when we're triaging headaches, there's multiple causes for it and we'll try and rule out whether the patient's got a history of headaches in the first place. So things like migraine, what have they been doing beforehand? And also we look at the acuteness of the headache. So has it come on suddenly? And that can be an indication of a cranial bleed that may lead to a stroke. Did it just come on like almost like a clap of thunder? Does she know, or has it come on slowly? Yeah, no, absolutely right. We need to be getting her up to the hospital to be seen because of that sudden onset, the way that she describes it, just coming on suddenly like that. Like I say, it's almost like the term we use is like a thunderclap. It comes on like that sudden peak intensity. Because of the nature of the way the headache had been presenting in Good Scots, heads bursting. And that is actually a phrase that we look for. It's one of our top sort of red flag 5, as we call them. So I was very keen to get as much information about that as possible. You know, when we do the phrase, the early bird catches the worm, can you get her to say that back to you, and just so that I can hear her saying it? That's lovely, good, no slurring. It sounds like a daft phrase, but it just helps move all the muscles of the tongue and the mouth and the jaw. Brilliant, okay. One of the reasons we use that is it allows us to do a neurological assessment very, very fast. So if there are signs of stroke, or a stroke coming on, even like a mini stroke, it will affect the speech, and that phrase is the one that's most likely to be affected. Right.
A stroke is considered a medical emergency, and urgent treatment is essential.
Is she being able to move her arms and legs? What I was getting at, is there any sign of weakness, like a stroke, leaning to one side, sort of facial weakness at all, when she smiles, anything like that? Yeah. Okie doke, bear with us. We'll have an ambulance there just as soon as. So when we're looking at things like stroke, we want to get that treated just as quickly as possible. We're giving them the best quality care, and we're giving them the best quality of life post-event as well. So the earlier we catch, the better the prognosis, the better the quality of life once they recover from that event. If you do notice any sort of sudden slump, any sort of slurring of her words, increased confusion, weakness down one side, holding herself differently, you just call straight back on 999. It's absolutely not a problem, but we'll get a wee hurry up as far as I can, okay? All right, cheers now, bye.
In Edinburgh, Kevin and Martin are en route to an 80-year-old woman who has had a fall at home and is complaining of abdominal pain.
You think it's a trip or a fall?
Oh, it says she feels like she's collapsed. I don't know if someone witnessed it or if she herself has thrown
from blood pressure or something. I used to go out with a girl who stayed here. I think it's at the back. Ah, it's here. Thank you very much.
You're very welcome.
The crew find the patient, Maureen, lying on the floor.
Hello there, my name's Martin from the ambulance service.
Her husband, John, explains what happened.
You got during the night to do a pee, and car followed us through. When we got to the pan, I turned around and she just collapsed down.
How did she get back through here? Sorry.
She's on a mat and I dragged her through trying to get to the bed, but I couldn't.
Okay.
Right.
And see how Maureen's breathing like this? Is this normal for her?
No, no, no.
You could tell just by looking at her that she was very unwell. Things go through your mind, like has she got a severe infection, that she might be septic? Has she got some kind of internal bleed that's causing her a lot of pain? Are you sore anywhere?
Sorry.
Sore in your tummy?
Yeah.
Has your tummy been sore for a while, or is it just this morning?
It's not
This morning. Is it painful when I press your tummy? Does that make it sore? It does. Where about? Down low? Down here?
It's very sore all the time.
Yeah. Have you had any bleeding or anything?
No.
No.
I don't think so, have I?
And did it just...
No bleeding.
She was finding it difficult to communicate with us exactly what it was that was troubling her, and, you know, pinpoint it exactly from her point of view, and that makes it a bit more difficult when your patient can't tell you in their own words. What medical history does Maureen have?
I'm not bad until a few years ago when she got the signals in the brain are not working right. And she'll remember a bit sometimes with me.
Okay.
When she walked to the toilet and what?
So she was absolutely fine on the way to the toilet, but it's after she's been on the toilet that this has happened. There was nothing obviously that we could feel in her abdomen that was causing it, and the observations were coming back kind of within fairly normal parameters and stuff, so it was a case of get some pain relief and get her up to hospital as quickly and comfortably as we can.
I was scared.
Hey, you don't have to worry, you're okay. You're all right, we're going to look after you.
John's there.
He's just there. We'll move out the way and he can come round and you can see him. Maureen, here's John.
Yeah. Yeah. Alright. You'll be alright. Alright. You'll be okay.
Maureen is in obvious distress. The crew decide she needs urgent pain relief. They will start with Entonox, otherwise known as gas and air.
We've got some gas here for you to take that'll help with the pain a wee bit. I'm going to give you a wee hand to breathe some of this in, and this will help with the pain for you, and then we'll get you moved up and onto our chair, okay? So I'm going to pop this in your mouth, and then I want you to take some nice deep breaths through that. There you go. So like you're sucking through a straw.
It's still sore.
I know. We're going to get this sorted for you though. I think if we can get her to the ambulance line, then we'll have another look for some IV access. You could tell by looking at her that she was genuinely in a lot of pain and a lot of distress, so it was appropriate to give her a stronger painkiller to try and get it under control.
Okay. Yep. There we go. We'll just get you over a wee touch.
John's just come in. Okay. Whereabout in Ireland are you from? What a lovely accent you have.
Yeah.
Yeah. How long have you been over in Scotland?
A long time.
A long time. You've kept your accent though. Was it John that whisked you off your feet and brought you over?
Maureen and John first met in Scotland while she visited family in the 1960s. They've been married for over 50 years.
We're going to get you feeling better. Here's John.
Look, I'm here. Look. Come on, I'm here. I'm going to come and see you in the hospital, okay? All right? I'm going to follow the ambulance into the hospital.
He'll be just behind us.
Okay?
Right, John. Just watch the big steps, okay?
With Entonox proving ineffective, the paramedics decide to swap Maureen's pain relief to morphine.
So we'll just give it in small increments. Okay. Let's wrap you up and we'll start getting you off to hospital. Just uncover this arm a wee second. I'm going to give you another wee scratch into this arm.
While the morphine has helped, Martin can see Maureen is still in pain and administers another dose.
That's us just turning into the hospital now, okay?
What do I do?
You just lie there and relax, it's okay. That's us here, Maureen, okay? It's easy for me to say relax, isn't it? I'm not the one that's sore.
We're going to take you into the hospital now, Maureen. Okay?
Before Kevin and Martin leave hospital, they are given an update on Maureen's condition.
So they've done a quick scan on her abdomen to try and find out what was going on. Apparently she's urine retention, so her bladder's full. So that's why she's in so much pain. Shame, isn't it? Because you never like to see someone still in pain. But anyway, that's her. She's on the mend now, feeling much better.
The city of Glasgow, home to over 600,000 people, served by 11 ambulance bases.
When I started, it wasn't anything like as busy as it is now. The city's expanded hugely over the years as well.
Paramedic Sally and ambulance technician Alana work out of Springburn Station in the northeast of the city.
We've worked together now for
just over
a year. So we're starting to get to know each other.
Yeah.
Go mobile. I'm good. Right, so where am I going? Camping.
Sally has worked in the service for 27 years. And although Alana is a relative newcomer, healthcare has been her life.
I left school and started as an auxiliary, or a healthcare support worker it's called now. And I've been in the ambulance service for 3 years now. So I've kind of always been in the NHS, really.
It's quite a privileged job. You're meeting all different people and you're in their lives just for a very, very small snapshot, and you just try and help folk.
So we are going to quarantine for Graham, 60 years old. Feels like he's going to faint, pains in chest and can't breathe.
This patient is already on a long list of medicines.
Temazepam, gabapentin, hyaluronic acid, Stexrol, enzoprazole, prednisolone, it's a lot of stuff.
It's quite common for folk to have a fair amount of ongoing medical problems that have got a lot of different medication that they are required to take. So yeah, some people have quite a lot.
Their patient Graham is waiting for them upstairs.
Okay, Pat, have you got chest pain, Graham?
Aye.
Aye? How long you had it for?
Just recently, see my breathing.
Uh-huh.
It's like I'm trying to get another breath.
You're quite short of breath. Aye. Have you had, I'm seeing you've got a nebuliser up there, have you used it?
Aye.
Is it not helped?
That helped.
Okay, when did you last use it?
15 minutes ago or
15
something.
minutes ago. What do you use it for? Is it asthma, COPD?
Yeah, that's COPD.
Right, okay.
COPD stands for chronic obstructive pulmonary disease. So it's people have problems with their lungs.
Just swing your legs out for me and we'll do some checks on you.
Glasgow, we've got a lot, obviously, of our elderly population that worked in the shipbuilding. They were welders, things like that. It's just a common thing that we see in Glasgow.
So see your oxygen. You're at 100% oxygen, okay?
Right.
That's grand.
You okay if I put these wee stickers on you, Graham? Aye.
So see the pain you're saying you're getting in your chest, is it a pain or is it a tightness?
Tightness.
A tightness, okay, pal. Have you ever had anything like that before?
No.
No? Okay. Where is the tightness in your chest?
Right, it's two sides.
Is it right across?
Aye.
Okay, pal. No problem. Are you able to stay sitting up for me, or are you?
No, probably.
It's a bit better for your breathing.
Graham's chest pain means an ECG is necessary to check his heart's rhythm and electrical activity.
Right, we're going to have to take a wee bit of hair off your chest, is that okay?
Right.
You get a hairy chest.
I thought we might manage, but I don't think we will.
Right, pal.
I was trying not to,
That's all right.
but it's not happening.
I think I'm going to need a 5-blade one here, big Gillette. We carry the razor routinely, we just keep it on our defibs. Obviously sometimes they have a hairy chest and the dots that we use, they won't stick to hair. It needs to stick directly onto their skin or we won't pick up a good enough signal to take an ECG.
While they wait for the results of the electrocardiogram, the crew grow concerned with Graham's breathing difficulties.
Is it salbutamol you're putting through your nebuliser?
I don't know.
You're not sure? Do you mind if I have a wee look?
It's in the top drawer.
Top drawer. Right, 2 seconds. Let me get in here. There we go. Right.
Oh, you've got loads of stuff in here. You've got the chemist. That is salbutamol.
When a patient is on a lot of medications, paramedics have to be extra careful in their treatment.
We tend to treat what we see. It can make it a wee bit more complicated, especially some of the medication, if you're not really sure what that medication's for.
Sometimes they can contraindicate each other as well, so like, you don't want to give a medication that might react with one of their medications. Do you take chest infections at all? Yeah?
I had a few, aye.
You had a few, aye?
I had a sepsia.
Sepsis?
Yeah.
Right, okay. When did you have that?
Double pneumonia. Oh, a couple of years now.
Right, okay. All right, pal. We done his checks, we done his ECG, but anytime there's chest pain, we recommend that we go down to the hospital to get some bloods done. That's just not something we can do at home.
A wee trip down to the hospital, my man? Eh? They can check you over, take some bloods and things.
So all the checks we've done, all right, they're okay, all right, but you obviously have this tightness in your chest and we don't want to...
No, I'll just leave it. I'll just leave it like that.
You want to leave it?
No,
we think you
no, Graham, I think you should really go. They can take bloods and things and hopefully help you.
So we had a bit of a back and forth discussion with him, but he didn't seem very keen and just wanted to stay at home. Why don't you want to come with us?
I thought you could try something out today.
The thing is, you need bloods for the definitive answer, pal. We can only do so much from the house, unfortunately.
If we feel that somebody should be coming with us to hospital and they don't want to go, then we will try as best we can to convince them that it's the best action and that they should be coming with us. If they still refusing to travel, we can't drag somebody out of their house. We would get done for kidnap or something there.
You've never wasted our time. We'd rather bring you down to hospital and make sure we've covered all bases, but we can't do bloods from here, unfortunately, but we need the bloods done to rule everything out.
Yeah, we get a fair amount of folk that don't want to go, or we maybe have to try and say, well, we really think you should be going. So it is quite common.
Just for staying. I don't think we're...
No, you're not going to come with us?
Going to convince them.
We need to get you to sign a wee thing, just that we've been out. Okay? And we'll leave you some paperwork as well.
But that doesn't mean you can't just phone us back.
Okay?
All right.
If you feel unwell again, you phone back, yeah?
Right.
And if you phone back because you're feeling really unwell, you promise you'll go with them?
Yeah.
We leave paperwork with them as well, with a brief description of what we've found, so that if it's another crew, they can see what we were getting. And we do advise if you get another crew out, then you really should be going to hospital.
The Scottish Ambulance Services Special Operations Response Team, also known as SORT, respond to some of the most serious and difficult to access incidents. SORT paramedics Neil and Gail are en route to a serious ongoing incident. A person has been struck by a train.
The person's been found.
It's been confirmed as human.
Okay.
I asked life status, and that's unknown.
Right.
Generally, persons hit by trains are fatalities. We've been to 2
I've been to two that have survived. They had life-changing injuries, but they have survived.
That's why we move kind of quickly to get on scene, and if they need any care, ensure that they get it as fast as possible.
So we are going straight on here, is that right?
Yeah, straight on, mate. There is a road access. Looks like the road goes underneath the railway line. Either way, it's going to be on our access route.
Train lines can stretch through really remote areas. You've got to walk alongside a train track for quite a while, so access is a big thing, again, for what kit we take to be able to transport the patient back.
Despite being told that the train line has been closed, paramedics receive a concerning message from a crew already on scene.
3440 to control and SOAR. Control, can we just double check that this line is actually blocked because there's a train passing us just now at the train station? Over.
Eastbound to 3440, they have contacted Network Rail and they have advised that there is a block.
I'm not sure it's entirely safe for them to continue right now if there's a train going past them.
Sort 250 to control. Yeah, I have a concern regarding the status of the railway line. If a train is still making its way past the incident, we do have to query whether the line is still live or not. Could we reconfirm with Network Rail?
Yeah, that should be the phone again just now and confirm.
I'm concerned about that crew.
Absolutely, yeah.
My understanding of what happened is it was actually one of the drivers was reversing the train. It was very slowly done, so it was handled safely. But nevertheless, any train movement that we hear over the radio, obviously that heightens our awareness that is the line actually shut. I'm trying to give the crew time as well, because they may have come across, the remains, or even indeed a live human. So try and give them a bit of space. When I was going to that incident, you think about the safety of the crew and all the responders that are going onto that railway line, but also you have to bear in mind that they're going to have to live with that for the rest of their lives. And even although you've seen it a lot, it doesn't mean to say that you become conditioned to it.
You can have a certain amount of professional detachment from a job like that, but we are only human.
Now, this is it just coming up here.
Yes.
Yeah, there's the feds.
On arrival, the crew's worst fears are confirmed. The person hit by the train has died.
When we first got there, the divisional crew had already said that, very sadly, the person had passed away. Our focus then shifts on to make sure the other responders are okay in the aftermath of it.
Hey guys.
Hello.
How is everybody?
Do your thing.
Rubbish, yeah.
So the British Transport Police are with the body. They're going to kind of look into it further and then get the undertakers along. So there's nothing else that we can do here at all.
Okay, guys, just getting everyone in together. So, through the British Transport Police, we're going to have some kind of forensic investigation. We still have a duty of care to the driver of the train, though, so we should try and make contact with that train driver.
There was two train drivers involved, one that hit the patient and the other one who'd gone past and spotted the patient on the line. And that's something that can have a huge impact on them. It's an extremely traumatic thing to do and to witness.
Sort 275, yeah, just an update. We are leaving scene just now, and our intention is to return with both call signs 230, 275. Over.
Thank you for the update, over.
Everyone will deal differently with certain jobs. We're only human, it's something you're expected to deal with, but it can be difficult sometimes.
Death is something that we are exposed to quite a lot, and sometimes that is traumatic death. It's never pleasant, but knowing that we do absolutely everything we can for that patient until it's very obvious that there is no more to be done.
Yeah.
And knowing that we've got a good team behind us and around us so that we can talk about anything if it's dwelling on us. I think the main thing out of it is to make sure that the drivers of both trains are checked.
Yeah.
Are you okay after that job?
Yeah, yeah. Are you all right?
Yeah, I'm good.
It's after midnight in Glasgow. Springburn crewmates Sally and Alana are on another call-out.
So, Catherine, 56, chest pain and palpitations.
999 mode activated. Sally grew up in Glasgow and, having worked here all her life, knows the city well.
Obviously, Glasgow's a huge place and it's got a huge amount of different people. We float into their life maybe for an hour or so and you get a wee story and you meet some characters. You certainly meet some characters, especially in Glasgow.
Yeah. It's got to be here, hasn't it?
She's waving at us.
No, I don't know what she's doing.
Their patient, Kathleen, is waiting upstairs with her partner.
I do panic attacks, but tonight my heart started to race dead fast.
Okay.
Yeah, I got pains going across there.
I just remember the room being very dark. She was chatting to us, like as soon as we went into the door, she was talking to us. It was more the tightness in her chest she was concerned with.
I smoked a wee bit of heroin.
Okay.
Yeah.
What time did you have that
at? About half an hour ago.
Half an hour ago. Okay, is that round about when the pains in your chest started?
No, it was
okay.
After that.
After that, okay.
Yeah, after locks and all that, and
Stick a wee finger in there for me.
Yeah.
Thank you.
So have you still got this pain in your chest right now?
Yeah.
Yeah? Where is it?
See right there, it feels as if somebody's squirting something there.
Right, okay. I had a suspicion that the heroin might have been a contributing factor to the anxiety and the chest pain. How often do you have a smoke?
The now I've got myself down to maybe a school bag a day for the 13th a day.
Aye.
And brought myself down because I know I'm not as young now to handle the withdrawals.
But you've done well to cut down. You don't know what's in heroin, do you know what I mean? It's one of these things that I think it could affect.
I think she was using it to try and
calm herself
down. Which I suppose it can.
I think it had maybe the opposite effect at this point.
I take panic attacks.
Okay.
When this happens, see, because I know I'm old now, and after
don't look at it to me, calm down.
That's going to get tight, love, okay?
When did you have your heart attack?
When I was 40.
You're 40. What age are you now?
56.
56. God, you're not old. Come on now. Is it just the one heart attack you've had?
I got 2 stents.
You get 2 stents fitted. And you said you've got angina.
I've had 3 strokes as well.
You've had 3 strokes as well. Was it mini strokes or were they?
Aye, mini
strokes. Okay.
I've got COPD, emphysema, asthma as well.
Oh, you've got it all, hey?
Nah, well, you've got to may as well do everything.
She did have quite a complex medical history with heart attacks and TIAs and all sorts of things. But I think the presenting condition that she'd also mentioned, she does take panic anxiety attacks.
My heart started beating dead fast.
Yeah.
And then I get pains going across my chest and down my stomach. And I know I shouldn't panic, but...
No, but you are going to panic, aren't you?
I think we were heading down the route of this as anxiety-related issues that we're having at the moment rather than maybe another heart attack or anything, but we're obviously still going down the lines of she has got chest pains.
See, all the checks we've done at the moment, they're all good, but we can't,
Obviously we can't see into the future.
Which is why we always advise to come down to hospital when there's chest pain, sweetheart. It's just one of these things. So it's good on there.
Good on there, but you know yourself, we need to get, it's blood that's the definitive answer with your heart.
No, hey, no, I'm sorry.
Listen, you don't...
I really apologise.
Honestly, you don't need to apologise.
No, the hospital just make my life things worse, honestly.
Can I convince you?
As long as I know I'm not going to die, I do apologise.
Listen, you don't...
You could be dying.
Stop it. No, stop it.
See them shoulders
You don't need to apologise.
Right? It's all right.
Okay, it's okay.
Got enough to be worrying about.
Right.
I like your top, by the way, a good Celtic woman.
Yeah. It's only on the weekend.
Did they win the night?
Good.
In Glasgow anyway, I mean, I think the first thing we tend to clock and how you have a lot of folk that are wearing Celtic tops, Rangers tops. Yeah, there probably is quite a lot of banter goes on at times, just trying to cajole people into coming to hospital. Sometimes it works, sometimes it doesn't.
So if we told you the full Celtic team were up at the Royal, we're still not going to win this game, no?
No.
No.
Not even the Pope is up there.
Chest pain, chest tightness, you're wanting her to come with us, but I think we both knew.
Yeah, you can't kidnap her. So.
No, she was not going to be coming. She was not going to be for leaving the house.
But you will go and see your GP in the morning? Or phone?
My doctors in the morning, yeah. Oh, thanks
Right.
very much.
No, you're welcome. Don't be apologising, you're fine, okay? How often do we have a shift? Like, patients not going? Especially patients that you do want to go? Hopefully she'll chill a wee bit and
I'm hoping so.
Calm down.
She was lovely though, isn't she?
Aye.
Just a nice person. She's been smoking heroin since 21. 21 years old.
21?
Yeah.
I think that might have been when she said, yeah.
Just wonder what happened for her to...
I know.
Just go down that road.